Is there a way of stopping it? I mean, I know it's a big question, but one asks themselves, how do we stop this? We've been talking about it for so long.
Yeah. I think we mentioned this in the last segment or before the break. Access is a huge issue.
Access is huge.
And there have been efforts that have gotten traction and proven benefits to reduce access to certain prescription forms of opiates, and interdiction to try to eliminate access to illicit forms of opiates on the street makes a difference.
I was curious, are police officers today maybe receiving training to help handle mental illness? I mean, they have so much on their plate already. I almost see them as teachers today who are also handling much more than just teaching the classroom. They have so much on their plate. But do they get trained for this, Laura?
This is a great program, Laura
Absolutely.
can describe.
We have a program here in Miami-Dade County called the Crisis Intervention Team, or Crisis Intervention Training. All our municipalities are trained, so we have a number of different law enforcement agencies here in Miami-Dade. We have City of Miami, we have Miami-Dade, we have Miami Beach Police. So all of our officers are trained in this intervention. If you get a police officer in front of you, you'll actually see a pin that says CIT, so you'll be able to identify and know that they are a CIT trained officer in our community. And when you call law enforcement, because you suspect potentially that your loved one is decompensating, you can request for a CIT trained officer to come to the home that have already received the specialized training that will be able to identify signs and symptoms and hopefully be able to de-escalate them. And instead of them going to jail potentially because some of the behaviors they're exhibiting, they'll take them to a crisis stabilization unit for help instead.